Oh, I see there's one person joining, and now a few. Thanks for joining this afternoon. It's April the 16th today, and the reason that we're meeting today is because a paper, or at least a correspondence from the experience in New York came out recently, a few days ago, and that has had a lot of time spent in the news and lots of questions coming around about the impact of COVID-19 in pregnant women and what to do. So I appreciate people tuning in. You may wonder why I'm doing this. I think in part, I've always written blog posts about various topics. And while those I think are well received, it's been my thinking recently that it's nice for people to have a little face-to-face in a time when we're increasingly socially distanced from one another. Again, thank you for tuning in. As I see, there's a number of people on, and so we'll get to it. And I don't mean for this to be a very long discussion, but what we're going to be talking about is the concept of universal screening for SARS-CoV-2 in women admitted for delivery. Why did this come about? Well, this came about because, at least this question came about because a couple of days ago in the New England Journal of Medicine, a prestigious journal, New York followed up on an initial report, which I talked about last time, which I believe was by Breslin. And the follow-up was with respect to, in middle of March, Breslin initially reported, and I spoke about it last time, about 43 women who presented in pregnancy with COVID-19. The good news from that study was that it certainly supported the notion that vertical transmission probably doesn't occur, because we know from that study that all 18 babies who were born during that time tested negative for COVID-19. So that was the good news. But in looking at the study, one of the things that comes out of that study was that 14 of the patients, 14 out of the initial 43 women who did not present with any symptoms of COVID-19. And so that represented 32.6% of the women who presented in labor did not have any symptoms of COVID-19. And because of that, New York decided that it was best at the New York Presbyterian Allen Hospital and Columbia University Irving Medical Center to institute universal testing of pregnant women, whether they were symptomatic or asymptomatic. Now, it's also worth noting that 10 out of 14 of the women who initially were asymptomatic went on to develop symptoms over the course of the stay. So this group decided to document the outcomes over time between March 22nd and April 4th, 2020, of a total of 215 women who went on to deliver at this hospital. The concerning part about the study, and this was a letter to the editor essentially, and the concerning thing that got everybody excited was that 29 of the 33 patients who ultimately out of the 215 were found to be positive for SARS at admission. So that means 87.9% of the women who presented had no symptoms of COVID-19 at presentation. So the concern there is, again, you have a significant number of women, not with COVID, it was 33 out of a total of 215, but which is still high, but that the large proportion of them presented without any symptoms. And so you can imagine if you're living in New York and you find these results, that could be quite frightening. Now, of the 29 women, when we look at what happened to them who had been asymptomatic but were positive, the statistics were that fever developed in 10% of them before postpartum discharge, and one of the women actually became symptomatic postpartum. So the news is that some of these women are going to go on to become positive after admission. And so this leads to some pretty big questions. If you know that there's a risk of women becoming symptomatic during their stay in hospital, and that they are presenting in labor potentially without any symptoms, what is the risk to the healthcare provider? Well, and before you really get into that, a study that just came out, I believe it was yesterday, in Nature, and made the news today on CNN, if you saw it, was a study called Temporal Dynamics in Viral Shedding and Transmissibility of COVID-19. And the gist of this study was that these researchers looked at 94 patients with laboratory confirmed COVID-19. And what they identified, and this is I think quite concerning, was that they identified peak viral shedding, at least they identified peak viral shedding when they tested positive with symptoms. So when they came in with symptoms, the viral load was very high, which led them to question in the paper, if they're seeing the peak then, could the peak have also been prior to the day of admission, or the day of testing? So what we have is a situation where women may present to your labor floor with COVID-19. They may not have any symptoms at the time, yet they may be quite infectious. So what do you do with it? Well, I didn't state it up front, but these opinions are my own, so I want to be very clear that I'm not telling you what my health region would be recommending, but I'm just saying these are some of the considerations. The first thing that you might do wherever you are in the world, and I see that there are people from different places, Maryland and New Zealand, for example. But what you might do is you might say, well, let's test everybody. Well, that may or may not work. That is dependent on what you have in terms of availability of testing. Do you have nasopharyngeal swabs to test everybody? Do you do a nasopharyngeal swab on asymptomatic people, realizing that you may have up to a 30% false negative rate if they have no symptoms? So how reassuring is a negative test? If you've been watching the news, one thing that also has been coming into the news is the idea of antibody testing. And if you're in the United States listening to this, you know that there's been a big push for testing using antibodies, because it would be rapid, it can be available in minutes, but from what I understand, in order to try to expand testing like this, the FDA has relaxed, and the initial antibody tests look like they may not be that great with low sensitivities and specificities. So right now, the question is, what do you do if you have a mom coming to your hospital? If you have plenty of tests available, that's one option. Antibody tests may be another. But the other thing that you may do, and there are limits to that as well, is what if you adopted a universal precautions approach? If you don't know whether mom's positive or not, if she's asymptomatic, one of the things that your hospital may consider doing is using PPE for everybody. Now, to be clear, I'm not suggesting that you use our precious N95 masks, but should you be using a gown with gloves and eye shields and a mask? It doesn't need to be an N95 mask, but a surgical mask to capture those droplet or block those droplets from entering your nasopharynx. That at the very least would seem to be a practical approach to dealing with this, because at the end of the day, if you don't have enough testing kits to go around, or it's just not feasible to test everybody, you could just take a universal approach. So the other thing, though, that needs to be addressed here is that this study was done in New York. And so why am I raising that? Well, I'm raising that because I'm not suggesting for a moment that this study is invalid. I think it's an observational study. There's nothing to say it's invalid or valid. It's just what happened. So we're not talking about analyzing a randomized controlled trial. We're just saying it's a study that was done and describes what the experience was there. The thing to remember about New York is New York has the highest number of cases in the United States, and burden of illness will affect to a certain degree, or a great degree, how many cases you see presenting. So if you are living in an area of the world where you've had very, very few cases, you have to consider what is the likelihood that I'm going to get a mom presenting in labor who happens to have COVID-19. If you're in New York, or perhaps if you're in Spain or you're in Italy, you would consider that risk to be fairly significant. If you're living in a place that has only had 10 cases in the entire community, the odds are less. So at the end of the day, what you need to do is your health regions need to look at what the incidence of the disease is in the community, and then if it's high, universal precautions certainly would be something to consider. And lastly, because I'm aware that universal precautions will require that you have enough PPE, that is something that you obviously need to check in, and what are your supplies, and can you afford to give universal PPE in this situation, or will you burn through the precious resources? Because we also have to bear in mind those on the front line in emergencies, emergency departments worldwide, who are seeing symptomatic people coming in through the emergencies. We have to maintain adequate supplies for them. So with that, that's my take on this. I think you're going to see lots in the news about this study and all of these asymptomatic pregnant women. I think that it's something that hospitals across the world will need to address and think about. And if there's any questions that I can help with in the next few minutes, I'm happy to address something. But if not, I would say it's been a pleasure meeting with you again. This is new for me, and it's something that I hope is of some help to people out there, and that some of this face-to-face contact, at least virtually, is helpful for people. And feel free, if you think of questions afterwards, you can post them to this thread. And generally I can be found at Facebook /allthingsneonatal, or www.allthingsneonatal.com for the blog, and at NICU_musings for Twitter. I do have one question, that percentage of asymptomatic in pregnancy. Well, that number, we probably don't know that number for sure. If you do the quick math, which would be difficult for me to do in my head right now, but if you look at the 215 women that presented in New York, which is a fairly good sample, we know that 33 ultimately were positive, and 29 of those were asymptomatic. So if you take 29 out of the 215, that's probably about 9% or 8%. So that's close to 1 in 10. 1 in 10 in the New York cohort. But again, you're going to have to put that in the perspective, which is important. Put it in the perspective of that's 1 in 10 in an area that has a very high incidence of people who are COVID-19 positive. So the percentage of asymptomatic patients will vary depending on what the incidence is in your region. Okay. All right, well, thank you everybody for tuning in. I hope this was useful in some way to you, and hope to see you again soon. Take care.